joined by my colleague Bryony Moe, who is also a project officer, and our programme manager Patty Lozano Casal is also here. So we sent a link to you this morning with the pre-session survey, finding my words this morning. If you didn't get a chance to complete that, we would really appreciate if you could do it, and Bryony's popping that in the chat. Yeah, so during the next hour, we will share what healthcare employers are doing to create mental health inclusive healthcare working environments, free from stigma and discrimination, and we'll cover why an inclusive approach is important and beneficial for both staff and employers. So also just to say that we are recording presentations and the Q&A session, and these recordings and the slides will be available on our website after we're finished today. So I'm just going to share my screen with you. Okay, so can everybody see that all right? Yeah, great. Okay, so some timings for today. I'll very briefly introduce why CME are working to influence anti-stigma mental health practice. I'll then introduce our first speaker, Caroline McDowell. Caroline has a meeting at 10:30, so we're going to get her to share all of her knowledge with us, and then we're going to let her shoot off. And you'll also have an opportunity to ask Caroline some questions. I'll then cover the definitions and impacts of mental health stigma and discrimination in healthcare workplace settings in more detail. We'll then hear from the wonderful Chip Duncan, who, apart from being a talented poet, hi Chip, and performer, is also a CME volunteer and speaks from a lived experience perspective. And then finally, we'll round up and take your final remarks before we finish at 11. So let's get started. So due to the nature of our conversation today and the content of our session, I want to start just by covering our Safer Space Agreement. So we're talking about mental health. It's a subject that can be very sensitive. So I wonder if we can agree that we will keep ourselves safe and safe during the session, that we'll only share information that is ours to share. And that please do take time out if you're feeling that the content is impacting you, and do contact us if you would like some support. So the second thing is that we show respect for the fact that everybody has different views and experiences, and we'll treat people in a way that we would like to be treated. And finally, that we respect people's confidentiality, and anything that is shared that is personal and of a sensitive nature shouldn't be discussed outside of this session. So if everyone is happy to agree to that, then we'll move forward to our next section. Okay. So CME is Scotland's national programme to tackle mental health stigma and discrimination. It's funded by the Scottish Government and is managed by the Scottish Action for Mental Health and the Mental Health Foundation. So we influence change in behaviours, cultures and systems, so as that people with experience of mental health problems are respected, valued and empowered to achieve outcomes that are important to them. And we prioritise settings where people experience the greatest levels of stigma, and the evidence and research shows that these areas are education, healthcare and social care and employment. So those are our focus areas. So I just want to start off with defining stigma and discrimination, so as we're really clear about what those two things are as we go forward in this session. So stigma is the negative attitudes or beliefs based on a preconception, misunderstanding, or a fear of someone with a mental health problem. And discrimination is when a person, an institution, or an organisation performs an action, whether intentional or unintentional, that creates barriers and inequality for people with lived experience of mental health issues. And we see the Equality Act as part of policing that discrimination. So the mental health and the Scottish Mental Illness Stigma Study was a piece of research, the first of its kind in Scotland, exploring how people who experience severe, enduring, and complex mental illness face stigma and discrimination in various areas of life. And these included areas identified, included relationships, mental health care services and healthcare services in general, online and in employment. So the study showed us that years of stigma and discrimination towards people with mental illness had left people feeling ashamed and assuming that the public and people in power had thoughts about them that were the worst, and including that they were dangerous and to blame for their conditions. And the impact of this discrimination is that more than half of people with mental illness respect themselves less and doubt their own capacity for recovery. So the impact on employees is quite stark. So the study had 346 respondents, 70 of which completed qualitative research questions. So nearly 3/4, 71%, had experienced stigma and discrimination around employment. 24% of respondents with personality disorder selected employment as a setting in which they did experience stigma and discrimination. People with mental illness found themselves out of work as a direct experience of stigma. 57% had been unfairly denied employment opportunities. 48% expected to be unfairly asked to leave their role. And of those who experienced stigma, 85% had stopped themselves from applying for jobs, and nearly half had left work due to stigma and discrimination. So the impact for employers is that, so we know that mental health stigma is prevalent, and the reasons that we would want to address that is the cost to employers, estimated at £56 billion in 2021, and presenteeism from mental ill health alone cost the UK economy £15 billion a year. Almost twice the cost of actual absence from work. So there are a number of key impacts for employers. So long-term sickness absence, retaining staff is an issue, impacting the quality of service that clients are receiving and the relationships as part of those. Yeah, so stigma is a huge part in these kind of negative aspects for employers. So I'm going to move on before before Caroline leaves us. And Caroline, if I can pass over to you. Caroline is the Work Well Specialist Lead at NHS Lothian, and her presentation today is called working well, introducing proactive mental well-being for all in North Lothian. And I'm just gonna stop sharing and pass over to Caroline. You
Great.
will get a copy of the slides. Sorry, I just saw that question popping up there.
Thank you very much, Rachel. Can I just check, is my slides now up and sharing? Yeah,
We can
great,
see
because
them. Yeah.
all I can now see is a small box of you, and I can see my slides, so I can't see anything else that's going on. So thank you very much for introducing me. I'm delighted to be invited along to speak today. So as you said, I'm Caroline McDowell. I'm the Work Well Specialist Lead, which is basically a title to say that I'm the Staff Wellbeing Lead for NHS Lothian. I'm responsible for implementing our staff wellbeing strategy. And I also do a dual role because I undertake the role of the Speak Up Ambassador as well within NHS Lothian. I want to be clear from the outset, I am no expert in mental health. I am in a role where basically my responsibility is to facilitate, operationalise the things that we are doing. I'm not in terms of a mental health expert or practitioner. I'm a trained peer supporter, trained Speak Up advocate and a trained mediator, but my responsibility is around helping coordinate all of our services and try and where possible to reduce stigma and discrimination in our organisation. And again, I want to be honest from the outset, NHS Lothian does not have this sorted. There is stigma in our organisation. There is discrimination in our organisation. As much as we don't want to think that there is, and we're doing lots of good work, the reality is there is. And I was speaking to someone just the other day, happened to say, oh, how's so-and-so? I've not seen them for a while. And this was in the workplace. And their response to me was, oh, she's off just now with mental health. And that summed up to me how far we've got to go in terms of that. And I had a conversation with that individual to say, we all have mental health. When you say that, you need to think about what that means. And actually, should you be saying that? Should you be sharing that? But just that bit of, oh, she's off with mental health, taking that, context of mental health is always seen in a negative, and not understanding the difference between we can do things to positively, proactively support our mental well-being, as well as experiencing negative impacts of mental well-being. So basically, I'm going to talk to you about how we have tried to introduce a proactive mental wellbeing support for all staff within NHS Lothian as part of our staff wellbeing strategy. So just a quick summary. Some of you, I can see there's a lot of people across NHS Scotland, but also others. So who are NHS Lothian? So a little bit of context is we're the second largest healthcare provider in the UK. When I think of that, I think, wow, geez, that's quite significant. It's a lot of work to be doing, a lot of people to support. We've got approximately 26,000 employees, and the reason I say it's approximately is that it fluctuates because we have our employees, but we also support doctors in training. We don't employ them, National Education Scotland does, but we support them in the organisation, and then we have our staff bank as well. So that fluctuates, but a significant proportion of employees. NHS Lothian strives to be and is doing a huge programme of work around being an anchor institution. And for those of you who don't know what an anchor institution is, it's basically where you've got a significant institution within a geographical area that can be an anchor for that community in terms of creating employment, reducing stigma, changing thoughts and attitudes, but also being able to use our communities and support our communities better beyond providing the healthcare of that. So we have that wider societal impact, and that's really important, particularly around the stuff we do around mental health. So stress, anxiety, depression and other psychiatric ill health is the categorisation of mental health in terms of our sickness absence recording in NHS Scotland. And in NHS Lothian, it has been our top reason for sickness absence for at least the last 5 years. It has been in the top 3 for at least the last 15 years. And in the last year, I was quite stunned to find out that it's now double the amount of our second reason for sickness absence, which is our musculoskeletal injuries. But if we're being honest, probably a lot of those musculoskeletal injuries that are recorded issues, sorry, musculoskeletal issues, probably a lot of them that are recorded are actually because of stress, anxiety, depression, and other psychiatric ill health. But people don't want them recorded as that often because there's a stigma. So, if we think about that, an organisation of 26,000 employees with a sickness absence rate that fluctuates between 5 and 6%, that's a lot of declared sickness absence. But what about those that have not declared it? Is that related to mental ill health? So, it's the tip of the iceberg. And I suppose that for us tells us we've got a huge amount of work to do. So NHS Lothian launched our staff wellbeing strategy in 2021, and I was brought in to implement that. And we've just refreshed it. This is our refreshed version. Basically, it's a strategy that's looking at, developed by our staff, that's looking at an overall ambition to create a healthier and happier culture for our staff by focusing on 3 key objectives. And these are key objectives that our staff told us about. And one of those key objectives is about proactive mental wellbeing support. And that's because we recognise that given that, significant impact of stress, anxiety, depression and other psychiatric illness, we need to do much more. We need to support our staff in a much more proactive way. It's not about waiting till they're off sick and getting interventions for them. It's not about it being left to them to deal with. It's about how can we support them in the workplace, one, for their sake, but two, for ours as an employer. There is a gain for us if we can support people much further upstream. Our strategy is all about self, team and organisation, and that partnership approach of it's not the individual's responsibility, neither is it the organisation's responsibility, it's a collective responsibility. And we've been focusing on that since 2021, and we've not changed our objectives when we refreshed it because they're so important. We've got such a way to go with them. So our approach is around 3 things: education and awareness. It's really important, like I say, speaking to that individual, they're off with mental health. It's important we educate people around the language we use, about understanding about mental health in the workplace and in society in general, and raising that awareness. And we've got a responsibility as an employer to do that. It's also about breaking down barriers and stigma. We are an anchor institute. We have a huge opportunity to influence a huge amount of people in terms of the population we serve, but in terms of the workforce that we have. If we can impact 26,000 people, what will that do out within society further if we can do that work? So it's really important that we focus on breaking down barriers and stigma. And then finally, it's about providing the appropriate support services for when our staff are struggling. It's not about us, waiting until they're in distress. It's about us providing stuff before that. But we need to recognise when staff are in distress, they need to have opportunities to reach in and get help in a timely manner. So we've introduced what we call a stepped care model. And again, as I say, I am no expert in terms of a mental health practitioner, etc. And I know there's some people on the call from Lothian who are. What my role is about pulling all of these services together. So I don't manage, for example, our psychology service, staff psychology service. I don't manage our staff counselling service. But what I do is I help facilitate them all to come together with the other services that we've got to try and make sure that we've got a much more collaborative approach. And what we've done in Lothian is recognise that we need what we call a matched care model as well, in terms of matching the care to the need of the individual. And prior to our strategy, we had some fantastic services. We still had our staff counselling service, and we had some other, our spiritual care team offered a listening service. But what we didn't have was that stepped care to match the needs of individuals at each stage. And this model that we've got, if we think about it, the majority of staff don't need a mental health trained practitioner. They don't need to be waiting for an appointment for a one-to-one. Often what they need is emotional, psychological first aid. So we recognise that, and we've trained 250 staff today in a framework called peer support, which is crisis intervention or psychological first aid. And we've got our spiritual care team as well, who can offer that staff listening service. And then we build on that with things like promoting self-help apps such as Sleepio and Daylight, and offering staff information and resources to self-help and further training. We've then introduced a staff psychology service where we can offer staff a one-off psychological support session, and that works really, really well. That's what the majority of people need. They don't need ongoing treatment. They don't need, the majority don't need highly specialist support. They need that individual who can be there to listen to the distress, to understand what's going on for the individual, to help them work out coping strategies and to put an action plan in place. And more often than not, that's what's required. But if that's not enough, then we can get staff into our more specialist support services, so our staff counselling service and our staff specialist psychology service. And they two services work very, very closely together to triage staff to make sure that we're getting people to the right place. But as I say, the majority of people don't need that. Our peer support service data tells us that 75% of people who come to our peer support service, and we can very quickly offer a confidential conversation with someone, basically within 24 hours, if required. We can very quickly match them up, have that safe confidential conversation, lasts about 15 to 30 minutes, and then we do a follow-up. And we do the follow-up to make sure we've got that safety net, that if someone is needing more than that, we get them into the right services. 75% of staff say that's what they needed, and they don't need anything further. We signpost them to other support services out with and other information. 25% of those staff then go on and would get put into the kind of waiting list for our more specialist services or that one-off psychological support conversation. That model's working really well for us in Lothian in terms of being able to get the right care at the right time. We do have waiting lists. I think at the moment we're looking at about 3 months for our counselling and our specialist psychology service, but actually when you look at someone going through their GP, it's a hugely reduced waiting time. So we're doing a lot to make sure our staff know that we've got this as an employer offering, which is really important, that staff can tap into this when they need it. And we were asked at the start about should we have a triage pathway, and it's a gatekeeper of you go to one service and then you can't go to counselling until you've been for a peer support conversation. And we were very clear, it is not for us to determine the pathway. It is for us to inform staff what is available, give them an informed choice about what they want to access, so they can access one or they can access all in terms of what's appropriate. It's about making sure that all of us, whatever service that we are in, so whether you're in the counselling service or whether, like me, I oversee the peer support team, we all know about each other. And we have a thing in Lothian where we say it doesn't matter what door you go through. If you go through the door and the person there understands all of these services, will get you to the right place. The fact that you go through a door is the most important thing, and reach out for help. So as well as that kind of support services, we've got a wellbeing programme, because we are about making sure that we can reduce stigma and discrimination, and you can only do that through education. So we've got our proactive staff wellbeing programme where we focus quite strongly on mental wellbeing support. This list is a list of some of the topics. We've been running this programme for over 2 years now. We've got 28 recorded sessions that are available for all of our staff to access at any time. And in any manner, they can access it out with work if they've got the password. So this programme is all about, we've been collaborating with a company called Camwell about that kind of upstream proactive early intervention around wellbeing in general, but particularly in terms of mental wellbeing. Which is fantastic. And we augment that programme with some other things. We've got things like a Reading for Wellbeing book club, where we have books around self-care and self-development. And again, there's a mental wellbeing lens to that as well, and it's really powerful. We come together, the individual gets the book, they read the book, and we come together and do a reflective practice, which is fantastic. As well as that, we're responsible for undertaking campaigns and providing that peer support to our staff across the organisation. It's one thing having education, but what staff tell us is, I want to know that I'm not alone. I want to know that what I feel is normal. I want to hear other people's stories. So this one, Nurture Nature, our campaigns aren't always like, oh, we're doing a mental health campaign. They can be much more generic, but have an element of mental wellbeing support within them, if that makes sense. So we worked closely with NHS Lothian Charity to do this Nurture Nature campaign in the spring. And that was all about, again, kind of if we can focus on outdoor nature, the benefits of nature, the positive impacts on our physical and mental well-being, then if we are looking after nature and looking out for nature, it nurtures us as well. So it was a really, really influential campaign, really well received. The charity got great feedback on that campaign, which is great. We also do things like our focus. So during the winter, we've done a winter wellbeing focus where we're highlighting information about all the resources that we have, because we've got so much going on and sometimes staff, they don't know how to navigate through it. And then we've done things like our peer support kind of sessions. So things like our virtual blether for menopause tea and talk. 78% of our staff are female. Menopause is a huge issue in the workplace for us. And as well as having policies and as well as having education, it's important that we create safe spaces for staff to come together. So we've been doing menopause cafes on sites, but also this virtual blether where staff can come together, and there are no experts in the room other than everybody in the room. And basically it's a safe space for us to share what people are experiencing, what one person's having might be completely different from another. We have a kind of unwritten rule that it's, there's nobody tells someone else what they should do. You should try HRT. Well, that might not work for the others. So it's about us all being together and respecting each other, but learning from each other and supporting each other. And we had a very, very powerful session the other week where it very quickly got into the topic of mental health related to menopause. So powerful. And actually out with that, individuals have been connecting in with each other to offer that kind of ongoing support, which is fantastic. So one thing that we're really thoughtful of is often we provide the support to all the staff, but who supports the people who support the staff? And that's really, really important. If I think about, so we've got psychologists who will get supervision. That's the part of the work that they do and part of their registration. Our counsellors will do the same, and they're in those substantive posts. But when I think about our peer supporters, we've got trained wellness coaches, speak up advocates, etc. They are all staff who have substantive posts but have come forward for specialist training to deliver these other services for us. So who supports them and how do we make sure that they're okay? Because sometimes, we can have vicarious trauma as a result of the things that we hear. So we make sure that we've got active networks to support them, that we've got ongoing CPD, that we've got sessions where we can come together. We've just done one for our peer supporters on tough topics. So we talked about sexual misconduct in the workplace, racism, and also suicide ideation versus suicide intention. And really, really helping those peer supporters understand you may have someone who comes to you who discloses that they're feeling suicidal. How are you going to deal with that? How do we make sure that we manage risk and that we can support the individual, but then how do we support you around this as well? So that's about how we collaborate with all our support services, how we all make the best use of each other, and we often get each other to come and talk to the different groups. So,
I think Caroline might have frozen there, unfortunately. Give her a wee minute.
I was worried that was just me.
What's that?
I thought that was just me.
No. Okay, I can't see Caroline. I think she might have be out of the call. I'll pick up where Caroline left off, and I think you'll all agree that that is such positive work that's happening within that programme, really inspiring. We were actually just about to lose Caroline anyway because she has another meeting. So I wonder if people.
Oh, Caroline's back, I think.
Oh, Caroline.
I saw movement.
Okay. I
think she's at the call now. Okay.
Is she back, Bryony?
Oh, there we go.
I can see she went out and came back in.
Apologies. I was talking
What?
into the ether. I was talking into the ether there.
Oh, Caroline, no worries at all. Listen, I know that you've got another place that you have to
Yeah,
be.
you're all right. It's fine. They know I'm going to be a few minutes late. It's fine. I'm not sure
Okay,
where I even got to in terms of the slides.
So we could still see, so you had talked about the menopause cafe.
Yeah,
Yeah, so yes, and you talked about the suicide awareness training.
Yeah. Okay. So so basically, yeah, we've been doing that. I suppose what I just wanted to end on is that, and can you see this okay, is that, we've got a lot of information. We talk to staff and tell them all about all the support services that we offer as an employer. And I don't expect them to remember any of them. What is important is that they know that there is stuff there for them. They don't need to know the differences in the moment. They need to know how to access information to find out the difference when they need it. So we've created this accessible information on our internet pages so that staff can access it at any time on any digital device. So you can now Google NHS Lothian staff support. Staff can be looking it out with their working day if they've had a tough shift or whatever. So that's just, these are just screenshots of our Google, of our NHS internet pages, because I think that's really important, that if people need the information, they get it at a time that they need it, as opposed to when they're near a work PC, for example. And in that, it tells you all the services we've got, as well as some of the national stuff, and it tells you what they are, how you would access them, when you would access them, and who they're for. So that was me. It was just, that was my last slide.
That's fantastic. Caroline, would you have time to do
Yes,
5
of
minutes?
course, of course.
Does anybody in the room, would anyone like to ask Caroline any questions? You can pop it in the chat, and perhaps, Caroline, you could respond. We could have 5 minutes, if that's all right.
Yeah, no problem at all.
Okay,
I think we've also got a few hands up, unless we've got Jane, hand up.
Hi there, Caroline. Thank you for that. That was really helpful. Did you do a selection process for the folks who were offering to do peer support, and a specific training program for them?
We did. We offered it out to everyone across our organisation, and we've done it in set cohorts. But we were very clear we wanted staff from all levels. We wanted staff from all directorates. And it's not that if you're a peer supporter in facilities, you offer peer support in facilities. If you're a peer supporter, you can offer peer support across the entire organisation. And sometimes it's more appropriate not to offer it in your area. So yes, we done kind of sort of informal interviews, made sure that there was appropriate, and their manager had to support to say that they were supporting them to come. And then we worked with PSA to do crisis management intervention training.
Thank you.
Thank you.
There's a few questions in the chat as well. So there's what is under the tab for staff who have workplace concerns?
So it's interesting, because when we were creating this, it's like, how do you cut the cake? You could cut it many ways to say, is it physical well-being, is it mental well-being, then breaking it down. So we've done things like, we've got support services, they're fast access, there's ones with waiting times, and then we've got that workplace concerns. And the reason, someone said, why have you put workplace concerns into the well-being stuff? Well, the majority of time, if staff have got a concern around whistleblowing or bullying, harassment, etc., they have concern about the concern, and then they have the concern about the impact on themselves, and it does translate into a wellbeing issue. So under that, we've got things like our trade unions, our Speak Up service, and our staff networks, and how you would escalate workplace concerns as well.
I think just given time, we're going to move on.
Okay.
I wonder if we could, Caroline, if we can pull these questions from the chat and and ask you them, and then we'll put them on our website with the feedback from this session. Would that be all right for everyone?
Perfect. Just for context, to answer the one that's important about how did we embrace the suicide awareness training, we've shared that with all peer supporters, mediators, etc. We've shared it with them, asked them to watch it, offered them the opportunity to have someone at the other end of a phone, depending, you know, how did it land with you? If there's any concerns, we're here. And then we come together to discuss it so that they've got the privacy to watch it, they've got the support if it triggers them, and then we come together to reflect on the impact of it. Okay.
Caroline, thank you so much for joining us. We really
Thank you.
appreciate your input to this session, and hopefully you're not too late for your next meeting.
No worries, and I'm glad it's been recorded because I'd like to see the
Caroline.
rest of it. Thank you.
All right, take care.
Cheers.
Bye.
Bye.
Thanks. So I'm going to start sharing my screen again, and I'll do, I'm not going to, just because we're running over just a little bit, I'm going to kind of compress a little bit of my slides, so you won't miss out too much. Let me just go through these. I should have had these set up, shouldn't I? But I didn't. There you are. So one of the key areas that we're working in on in CME is around intersectional stigma. So how do we understand stigma where it is cross-cutting across social identities? So where someone has a mental health issue, but they're also like anyone, everyone has a race, a sexuality, ability levels, gender. How do inequalities that affect us in terms of our identities compound with stigma that we're also may experience as part of our experience of mental ill health? So that's something that CME as an organisation, as a project, are exploring at the moment. So I'm very quickly in my brain deciding what is essential and what is not, given the time that we have. So CME identifies 4 types of stigma, and these are self-stigma, structural stigma, stigma by association, and public stigma. So self-stigma is the judgment that people put on themselves, so the internalization of stigma and discrimination. And sorry, I'm just letting someone in from the waiting room there. Structural stigma is where stigma may be experienced through the actions of an organisation or an institution or a person, and these will sit within our policies. So one of the kind of key ways for us to address inequality or stigma in our organisations is to kind of proof our policies to make sure there's nothing within them that is causing people inequality. Oh, sorry. And then, so stigma by association is where someone who is connected to someone that has a mental health issue is stigmatized due to that association. And then finally, public stigma, which is probably better termed as prejudice. So this is about kind of misconceptions and myths around people with mental health issues and a kind of damaging rhetoric. I'm going to skip over this. This is, I think that none of us are without knowledge about what the issues around staff mental health in healthcare settings are, that there's huge demand for provision, which is then countered by capacity and resources, the negative impacts of COVID, the EU exit, the cost of living, also exposure to trauma as part of jobs within healthcare. Staff report an elevated risk of stress, burnout, depression, and other mental health challenges. Existing inequalities in mental health disparities, and also fear of disclosing due to stigma itself. So how do we tackle it? So as I said, ensuring that our policies explicitly state that mental health is included within the definition of disability. Reviewing all organisational policies and procedures to ensure that there's a commitment to employee mental health, and it's embodied within those and not siloed, and empowering and including people with lived experience to shape what that looks like. So CME has done a lot of research around what works within organisations, and there's a whole field of research dedicated to mental health stigma, and we've combined all of this evidence into 7 key building blocks on what works for mentally inclusive workplaces, and these include leadership buy-in, so commitment and engagement, conditions for safe and effective and pertinent disclosure for staff, effective training approaches, awareness and literacy, confident and informed line management, so that when people are presenting or speaking that they're going to be understood and confidently supported, effective implementation of reasonable adjustments, and finally being a stigma-free organisation and really having that culture and that ethos bedded into the organisation. CME can help with this. Excuse me. So CME have a huge range of free resources, and specifically Bryony, my colleague, works within or leads the workplace settings part of this. Bryony's already put a list of these in the chat for you, and we would really encourage you to come forward and take advantage of these aspects and resources, and there's e-learning, guidance for managers, self-assessment tool that all link in with our CME and Work programme. The benefits of getting this right are huge for employers. Excuse me a second. Dry throat. So 80% of people said that they consider an employer's mental health support or policies before they even accept a job, and there is increased employee engagement when we get it right, increased productivity, increased customer satisfaction, reduced long-term sickness absence. I'm going to let you read the other 2, and I'm going to pass over, before I completely lose my voice, to Chick. Chick, if you wouldn't mind sharing your part. We're really pleased to have you here doing this with us today. Really appreciative.
Okay, thanks. I'm crossing the fingers. Can you hear me?
Yes.
Good, because I've had so much trouble with Microsoft Teams in the past. Okay, I'm kind of busking to some extent here, because I've been listening to what you've been talking about and thinking, what can I say that's relevant? I mean, I could tell you long stories. I've got probably a 40-year history of obsessive compulsive disorder, and sometimes depression as well. I haven't worked full time since 1989. I'm talking to employers here. I haven't worked full time since 1989, and for most of those 35 years, I've been relying on incapacity benefit. So the condition was recognised as a disability, that it got me the benefit okay. But I've been relying on that for, as I say, a long time. There were 3 years where I tried to come off benefit, basically because I'd done a few more hours and earned a few more pounds than I was allowed to earn for the allowed, permitted work thing. So I tried to come off benefits, go self-employed as an IT tutor, and within about two or 3 years, I had debts of £25,000 and no obvious way of paying them. And I eventually got it paid off, but with the help of family and so on. So that's the kind of mess you can find yourself in with this kind of condition. Also, just very briefly, I've only ever really had one serious relationship in my life, and that was a long time ago. And I've in the first half of my life, I had one address. The second half of my life, I've had 38 and counting, because I have to keep moving because the compulsions, the obsessions build up. I move to somewhere new, I get a wee honeymoon period for a while, then it all starts again, and so on and so on and so on. So that's the kind of the downside, and that's, I think some of you will probably know, the World Health Organization characterises OCD as one of the 10 most debilitating conditions you can have. So that puts me in one camp. However, the other side of the last 40 odd years, since diagnosis, I've gained, and I don't mean any of this in a boastful sense, it's to try and give you the two sides of the condition. I've gained 2 postgraduate qualifications. I already had a degree. I've worked part-time. I've never worked full-time, as I've said, in all that time, but I've worked part-time as an IT tutor in community education, an IT tutor at Glasgow University. I looked after one of the websites at Dundee University. It was the law department. All these international law professors looked after their website for a wee while. I was becoming quite unwell again, so then, without getting into all the coincidences that took me there, I went to live in a Buddhist monastery for 4 years. Sammy Ling, Kaju Sammy Ling, some of you might know it. I've also spent 2 years living at Lothlorien, which is a therapeutic community for people with mental health problems, where I was actually there as a volunteer co-worker. I had originally wanted to go as a resident, and that's a whole long story. But I was there as a volunteer co-worker, basically supporting people who weren't quite as far along the road to recovery as I was, or in 1 or 2 cases further along. Just on that topic of Lothlorien, to give you an idea of how embedded stigma can be, and admittedly this was about 20 years ago now, but I went to one of my psychology appointments. It was a trainee clinical psychologist I was dealing with at that time. Sometimes I saw the supervisor, but this day it was just the trainee. I was talking to her about Lothlorien and the different approach they take. It's a gardening community, among other things, and I was saying, I've checked it out online. It looks quite good, and she was very negative, blocking me, and eventually it was left. She couldn't make a decision anyway. It was down to the higher ups, shall we say. And at the end of the session, said, right, that's us. I'll come back in a fortnight, sort of thing. And she'd talk to the supervisor. I'm getting on my jacket, and she's picking up her papers from this low table, picking up her folder and stuff, and then she said to me, well, just before you go, I'll drop a bombshell. What would you think about psychosurgery? That's a bombshell. To my eternal satisfaction, I snorted, excuse me, and I said, you mean cut out a bit of my brain? And she said, oh, no, they don't do that these days. These days they just pass a wire through and target a very small area. Oh, that's great. So I won't go any further on that one, but that's one of my favourite stories. But that's how stigmatised you can be. I mean, I've told you about, the postgrad stuff and other, but there's this person, let's just cut out some of his brain and that'll sort his problems for him, with no idea at all of what my future would be after that. I mean, I know what it can do, lobotomy. It can be quite serious. It can really mess you up. So that was kind of one of my experiences. I don't want to talk too long. I realise I'm sort of. When do you want me to finish?
You're okay, Chick. Have you got any kind of final comments that you would like to make at all? And
yeah, as I say, I was just busking there. That just came to me as I was talking. What I would say is, I certainly self-stigmatised. at the very early stage. And then when I moved down to London and I was attending a psychologist there, I told Karina Boston, her name was, I told Karina Boston things I'd never told anybody in my life. I was about 30 odd by this point. And that was a huge benefit. And what I realised was that talking about it helped. And gradually I came to the point where, well, as you can see now, I'm completely open about it. I sometimes probably overshare, but I find that is the easiest way of dealing with it for me. It's not for everybody, but it diffuses situations so quickly sometimes. Quick example, I was getting a new suit a few years ago to go to a wedding, and the guy measured my chest, got me a jacket, said, okay, now here are the trousers that go with that jacket. If you just go in there and try them on, we'll see if we need to do any adjustments. And I couldn't do that because I have to, if I was taking off the jeans, I'd have to wash my hands. And there isn't a hand basin in the changing room. So I said, I'm sorry, I can't do that. I have OCD. It would be, can I just take them away? And if I need to bring them back, bring them back. The guy scarcely missed a beat. And he went, oh, okay. And just passed me on to the next person. Rather than me going in there and into the changing room and trying to take my jeans off with one hand and all that nonsense, it just solved the problem so quickly. And you sometimes get a bad reaction from people, but usually I find people are okay with it. So that would be my sort of takeaway, I suppose. I just find it easier to be open about it and talk about it. And as Patty and Rachel might be able to tell you, I sometimes write about it as well. Okay, so thanks very much for listening.
Thank you so much, Chick. We really appreciate your contribution. Thank you. So we're coming to the end of our session, and I just wondered if anybody had any reflections or anything that they would like to share as a group. And feel free to unmute yourself or to put anything in the chat.
I should have said I'm happy to answer any questions if there's time.
Thanks, Chick. Yeah, if anybody's got any questions for Chick. So I'm not seeing any hands up. Bryony, am I seeing all of the screens properly?
Yeah, you are, and there's no questions in the chat, but lots of thank yous for your contribution there, Chick.
Great. Well, so thank you to everybody for joining us. I'm just gonna very
Patty's
quickly...
got her hand up.
All right. Hi, Patty.
Hi, I was just going to say thank you again to Chick for, sharing all of that. And I just wanted to, I guess, I put a comment in the chat about the importance, again, of considering everyone's life in terms of the employee. I think as line managers and employers, we tend to focus on how people are at work, not realizing that there's so much stigma around conversations about many things that impact on people when they're outside work. Whereas it could be a health condition, it could be things that are happening with, a family, it could be bereavement, it could be, mental health problems or illness. And I think it's so important to have that in mind, because that's what people are really bringing to work. And it's so hard for everyone to leave things behind. Some people are better than others, but I think we need to be very vigilant for these things. And I just want to make that point because it's so important and often it gets missed. It's very obvious, but it's really easy to forget when we are busy and we don't really have much time for conversation. So just want to say thanks again to Chick for reminding us all of those elements.
That's great, Patty. Thank you so much. So on the screen at the moment, you'll see some signposting for support. And before we finish, I want to just hand over to Bryony, who has an event, a CME event that she would like to share.
Yeah, thank you. Stuart, I can see that you've got your hand up. I'm actually about to speak about supporting a mentally healthy workplace. So in relation to that, it may be relevant. So we work with Public Health Scotland and the Scottish Government, on delivering their quarterly workplace engagement, where we talk about like different issues that are relevant to people in the workplace. So our next session coming up is on the 31st of October at 9:30 a.m. to 11 a.m. So if anyone's interested in that, I'm going to pop a link into the chat of where you can get more information, and where the Eventbrite will be shared, and it'll also be shared on our website. But that session specifically focuses on young people's experience in the workplace and how to support the mental health of young people and young professionals that are coming into various workplaces across sectors. So if that is of particular interest to anyone, then please do sign up. There's a link there around about how to get more information about that session, and we'll also be sharing it on our website. And Stuart has also popped the link to the general like supporting a mentally healthy workplace webpage, which has also got loads of resources for supporting people in your workplace, both as employees and for service users that you work with, to have an environment that is mentally healthy, inclusive, and is free from stigma and discrimination. So there's those two links in the chat there as well. Patty, I don't know if you wanted to add anything about that. I just gave a very quick run through because we've got 2 minutes left. So if people are interested in that event, there's where to find more information.
Yeah, no, definitely. Thanks, Bryony. Just to let people know as well, we are running other webinars. Some of them might be longer than others. Bryony is working on one in November about men's mental health and the impact of stigma in terms of supporting men's conversations in the workplace. And we also have a plethora of resources for people to take action depending on your role. There's always some action we can take. So if you want to have a look and struggle to find anything you're looking for, just get in touch with us. All the resources, our support is free of charge, is funded by Scottish Government. So we can definitely have conversations, reach out if there's anything you want to do, but perhaps you're sitting there thinking, oh, I don't know what is within my sphere of control to do. We can have a wee chat. Thank you.
Thank you, everyone, for joining us. We'll finish up now. Thanks so much.
Thank
Take
you.
care. Bye.
Thank you for coming. Bye.
Bye.
Thank you so much, everyone.
Brilliant.